Lead the Way is a community-based HIV testing program. It's built on this test and treat model for HIV prevention. And the idea behind this model is that if you get everyone in the community tested for HIV, and then get those who are HIV infected on treatment, that you could markedly reduce the transmission of HIV in the community. So here in San Diego, Lead the Way, which is actually the world's first comprehensive test and treat model for HIV prevention, we're really focusing on the 92103 and 92104 zip codes because we find that less than half of American adults have ever been tested for HIV, and as many as 1 in 5 individuals who are infected with HIV don't even know that they are. So it's really important for adults to get tested, and it's actually part of the Centers for Disease Control and Prevention's recommendations that all adults get tested for HIV. Lead the Way was conceived in fall of 2010. It's the brainchild of Dr. Susan Little at UCSD. Inspired by this test and treat model for HIV prevention, a lot of HIV testing programs and campaigns really focus on testing only and not necessarily the treatment part of HIV care. So really sort of embodying both of those components and also moving past this whole idea of risk. Because when we think of 1 in 5 people not knowing that they're infected with HIV, a lot of times those are people that don't think they're at risk for infection. Unfortunately, these individuals who are infected and don't know their status, a lot of times are those who are spreading the virus to others. But the idea is that we're really starting to see that those pockets we need to break into for testing are a lot of the population that really just doesn't think that they're at risk for HIV. So I always tell people the married mom in North Park with 2 kids just doesn't think about getting tested for HIV, and that's sort of the reality of HIV testing for a lot of people. So I really think that's sort of our next goal with Lead the Way, is to get into some of those communities where HIV testing just isn't a consideration. Budget cuts have affected Lead the Way because we are funded through federal funding. So what that means for us directly is being able to pay for the resources that we need to do the HIV testing, to pay for our HIV testing counselors, to do our community-based testing. And so just within the last few months, we've actually had to suspend some of our community-based testing just because we don't have the staffing and the resources to maintain it. And so sort of the question that we ask with Lead the Way is, would you or wouldn't you take an HIV test? So if someone says, no, I wouldn't take an HIV test for whatever the reason is, then we do invite them to participate in a survey that's done on an iPad that sort of teaches us about their attitudes and barriers about HIV testing, to really understand what is it that's keeping people from getting tested in the first place. So that's sort of the no option. But if people do say, yes, I would love a free confidential HIV test, then we're more than happy to give them that test. And they actually participate by doing a rapid test, which is a quick 1-minute finger prick test that will tell them their results before they leave their appointment. And then we also do collect for them that same survey information about sort of their attitudes and barriers for HIV testing. Because part of really understanding how we get larger communities to test for HIV is sort of getting into their minds a little bit and looking at the reasons and the rationales behind why they don't get tested. Because particularly in the communities where we're focused, we have a lot of people who are very conscious and aware about HIV testing, but we have just as many who don't think about it at all. We have a number of people who are telling us that if their healthcare provider recommended getting tested, they would get tested. So that's really another area that we see sort of in the community at large for some improvement, is to get healthcare providers on board for offering testing to their patients. And whether or not they want to do the testing themselves is completely up to them, but as healthcare providers, they should at least be recommending it. So part of Lead the Way in the big picture of this test and treat model is that in order to understand if making testing available reduces HIV transmission rates, we sort of have to know how many HIV infections there are in the community to begin with. And so then that gives us sort of a starting number to understand how many infections are in the community, and then how many are new infections that we're identifying, and then if that number goes down over time. So the HIV test that we use, and we actually just switched to a brand new HIV rapid test. And so this is a rapid test that looks for antibodies to HIV. Antibodies for HIV, depending on the individual, can take anywhere from 3 to 6 months to show up in detectable levels inside a person's blood. And so when we test someone, we just do a finger prick, we take some of their blood, it's mixed on this sort of filtered membrane, it's given a developing solution, so it's a really quick process once the sample's taken. and you get your result actually within a minute with the new rapid test that we have. We're the only people in the county using this new HIV rapid test that only takes a minute. So for a lot of people who are nervous about getting tested and sort of that wait time for getting their results, it actually makes it really easy because you fill out paperwork and then before you know it, your results are ready. People respond to the news of finding out that they're HIV infected very differently, and so our trained HIV counselors help them sort of talk through that process and right away work to make them a follow-up appointment at the AVRC for confirmatory testing and to sort of take that next step in their HIV care. And we even have programs through the AVRC that help individuals sort of bridge from being newly diagnosed to the services that are available to them that get them the appropriate insurance and the funding that they need to get their medications. So the storefront location is really sort of the main presence that Lead the Way has right now. On occasion, and again, due to federal budget restrictions and federal budget cuts, we've had to cut back on some of our community-based testing. But the community-based testing is a big part of our success, particularly events that draw natural crowds, because beyond being able to offer testing in places that are really convenient and accessible, it also serves as an educational moment for us to really talk to people, especially those that don't think about HIV testing, to talk to them more directly about the need and importance of getting tested. And then for a portion of Lead the Way, back in 2011, we did do door-to-door testing, which was sort of a first with HIV testing of taking it door-to-door in these neighborhoods. That was a program that we did for about 7 or 8 months, but what we found out very quickly is people's responses to our HIV testing counselors at their doorstep was very similar to a door-to-door salesperson. So we got very few people that wanted to talk or wanted more information, and even fewer that wanted to get tested. And so what we found during that sort of experiment of going door-to-door was that doing community-based testing was actually more effective. Being in a regular, consistent sort of community location or at community fairs and festivals got more people tested. And so, you know, for lack of a better phrase, we got more bang for our buck by doing community-based testing than we did going door-to-door. When Lead the Way was first rolled out, our billboards and bus shelters didn't feature sort of the phrase or the word HIV in it because there was a very conscious effort sort of from our marketing team to not talk about HIV right away because so many people would just tune out. If they didn't think HIV was something that concerned them personally, then seeing HIV on a billboard was an automatic cue that it doesn't apply to me. So really getting those role models up there and directing people to the Lead the Way website was sort of our way of, you know, piquing a little bit of curiosity and interest, and then putting it on the consumer's responsibility to sort of dig a little bit deeper and find out what Lead the Way really is about. And then as that campaign sort of evolved, we got a little bit more explicit about what it was and sharing more, you know, stats and facts about HIV as a way to educate. So I would say that education probably is the biggest barrier to the success of Lead the Way because education just takes time. Getting people to understand really what HIV is and how it not only affects them, but it affects everyone.